How to reduce your baby's risk of sickness. There are things you can do to protect your baby during the first few months of life, Dr. Sabella says. 1. Limit outside exposures. You can't keep your baby in a bubble until he or she reaches the 6-month mark. But you can limit contact with other people. And ask visitors to wash their hands before touching the child. The first 2 months of life, we really regard as a sacred time to try to limit exposures as much as possible because babies can get viruses from people who don't even know they're contagious yet, he says. 2. Watch for fever. It's difficult for doctors to determine whether a virus or bacteria is causing an infant's illness. So, they err on the side of caution. Any fever 100.4 F or higher will likely land your baby in the hospital for antibiotic treatment, Dr. Sabella says. In some cases, doctors will order a spinal tap to rule out meningitis. Our ability to distinguish between a virus and a bacterial infection right up front is limited, he says. We often have to do everything and treat it to rule out worst-case scenarios. 3. Keep up with vaccines. Keeping your infant up to date with vaccines is critical, Dr. Sabella says. The whooping cough, pertussis, vaccine is particularly important. The illness is life-threatening for a child under 6 months of age. Babies should receive the vaccine first at 2 months, he says. HIV and Prevnar vaccines protect against bloodstream infections and meningitis. If you're a woman reading this before having your child, consider getting the flu vaccine. It isn't given to infants. But vaccination for the mother during pregnancy protects the baby as well. Being aware, taking common sense precautions and connecting with a doctor as needed all can help protect your newborn baby. Subscribe us to know more health tips and home remedies.